we have a treat for you today. We have a patient that we took care of. It's like 7, 8 years ago, actually. And it's going to be quite a reunion, and Jennifer is going to talk to you. And we may have another one coming on too before the 30 minutes is up. But I'd like to start out just by making an opening little comment. You know, so many patients come to me, to our clinic, after they've been elsewhere and talk about how they were treated like it was a factory, like they were cattle in a factory, and really no personal communication, no direct communication, and they were kind of lost in the chaos. It was very upsetting because infertility is very stressful. And I just think, how many times have you tried to call your doctor's office and you hear a robot answering service, a computer saying, if you would like to talk to a nurse, please press 1. If you'd like to get your prescription refilled, press 2. If you'd like insurance information, press 3. And 6 different options. And then when you press one of those options, the robot says to you, we are very, very interested in your call and we really care about you. But right now, all our operators are busy. And so will you please hold on, and we'll get back to you just as soon as we can. But we care about your call, so please hold on. And then you're on listening to some terrible music for 30 seconds to a minute. And then that automatic voice comes on again and says, please continue to hold on because we really care about your call. It's very important to us. But if you'll hold on, someone will reach you as soon as an available operator is ready. And you wait again, and you're listening to that terrible music. And quite seriously, it's 5 minutes or 10 minutes of this. And meanwhile, your blood pressure is going up. It's very, very frustrating. And you might or might not finally get someone to answer who doesn't have any idea who you are. And you tell them what your problem is. And they say, well, I'm not really familiar with that. So hold on, and I'll get someone who is. And then again, you're holding on for another 5 minutes. But at least you talk to a human being. So, Jennifer, I'll ask you. Jennifer's was our patient 6 or 7 or 8 years ago. This is a great reunion. She looks very happy, and she just volunteered to do this. And what was your experience when you first called us?
It was great. I surprisingly got a human being on the phone right out of the gate. I spoke to a very nice person on the phone who was able to schedule me fairly quickly. I think it was within a month, I want to say. And prior experiences, I had reached out to a couple of other infertility specialists, and it was quite a long time before they would be able to see you. I think that the average wait time was like 6 months from what I recall. So yeah, I did speak to a human, and I actually had a great relationship. I can't recall her name, so I don't know if she's still there. But every time that I called initially to schedule and then with questions to follow that, it was wonderful. I always got a call back right away, and a real person on the phone.
Well, I'm glad to hear you say that, because one of the things that is very important for infertility patients is there's so much stress and worry. Your whole feeling of your life's future, everything that you care about, passing on yourself to the next generation, is hanging on this thing. You're listening to a robot, and this robot tells you how much it cares about you. And the hypocrisy of that just can be so miserable. But then tell us about your story. I mean, my gosh, you first came to us, you were like 43 years old, and we told you about the problem with older eggs. And this is a classic modern story. The majority of patients nowadays in a fertility center are well over 35, over 40, and you have a happy story. So tell us whatever you want to tell us about it.
Yeah, so I had been to a couple other, as I mentioned, I had been to other fertility clinics before finding you. And I was basically just told, it's really not looking good, and there's not really anything that we can do, and you can try, and we're willing to try, but it's, they were pretty much discouraging me. So I started to do a little research and I discovered Mini-IVF. And then upon learning more about Mini-IVF, I discovered you, Dr. Silber, because you were pioneering that technique. So my first thought was, let me go and speak to him and see if this is an option for me. And I remember you giving the analysis, or somebody gave me an analysis in case most people are saying, well, what is Mini-IVF? It's less medication. You're basically trying to cultivate fewer, and I'm not the scientist here, you're the doctor, so hopefully you can confirm or deny what I know, but that you're cultivating fewer, better quality eggs and shaking the apple tree. And instead of having all of these low quality eggs fall to the ground, you're looking for less medication and better quality eggs. So I came initially to discuss that option. And after having some blood work, you told me that it certainly was possible for me to do Mini-IVF, but not that there wasn't a high likelihood that I would have success. And given that, as we all know, IVF is an expensive endeavor, I had only so much resources that I could devote to it. I was going to be paying all of this out of pocket. So you had mentioned to me the idea of doing donor IVF. And interestingly enough, my best friend had also done donor IVF. Donor IVF being IVF using donor eggs. So you mentioned that, and you said basically you'll have a baby. You know, if you choose to go that option, you will have a child. And you talked a little bit about nature versus nurture. And I went home and thought about it. I had to sit and think, you know, oh, what does this mean? And how am I going to feel about this? And what's this journey going to be like? So I sat on it for a minute and I decided, you know what? My friend I have two friends. I was a former dancer. So a lot of us waited until our career was complete. Sorry, dinner's ready. We waited for our career to finish before we started having children. So I had two friends that had been through the donor IVF journey, and both of them had, you know, wonderful experiences. So I decided that I did want a child, and if that was the way to do it, that's what I was going to do. And I proceeded with donor IVF. I think you recommended different databases in which to find a donor match, and it took me quite a while. That was the only frustrating part of my experience, which actually had nothing to do with the Infertility Center of St. Louis. It had completely to do with a different agency in which I was finding the eggs. But eventually I did find the right match, and we were successful. The two embryos were implanted, and I got pregnant on the first try. I now have a 6-year-old daughter, and I know that there's a lot of feelings and thoughts about donor eggs, but what I can say for myself and my journey is that if I could go back and restore my own eggs so that they were usable and change history, I would still choose the path that I took. I love my child so much, and I would change nothing about my situation, and I would change nothing about my choice.
You know, that's just absolutely fascinating, and I'm sure people will want to hear about this. So it's really your baby, even though it was a donor egg. And how did you know that would be the case? I mean, this is always the case. We've done this since 1986 for women that have run out of eggs. And I know everybody wants their own eggs, but when you can't have your own eggs, we've never had an unhappy case with someone that had to resort to donor eggs. How did you know weren't you a little afraid? How did you know this would be the right path?
I didn't know that it would be the right path. I knew that I wanted a child, and I knew that I had friends who had had success with that method, but I didn't know how I was going to feel. I stepped into it with an open mind. I had studied a little bit about epigenetics, so I did understand a little bit that actually a donor child has 3 parents instead of 2, and that there would be influence from my body. It would influence how the genes would present. I'd read about horses and like, like donkeys, a donkey embryo implanted in a horse, and that when the donkey embryo was born, it actually looked like a horse, not a donkey, which I found kind of fascinating. So I was interested in that aspect of it, the scientific aspect of it. But during my pregnancy, I was like just sort of stepping out into the unknown and just being hopeful. And when she was born, within, minutes, she was on my chest and I felt the bond. I felt that instant, like, this is, the most amazing thing I've ever experienced. And from there, from that moment, I was attached during my pregnancy, but I've heard, like, there were moments where I was like, I don't know how I feel. I don't know how, what this is going to be like. But from the moment she was on my chest, from there forward, it was a bond. And there are things about my daughter that I see that don't look like me. But I've fallen in love with that person regardless. She does have blonde hair. She is tall. So I did purposefully choose somebody that resembled me just because that's what I wanted. However, she has things about her that are totally not me, and that makes me love it even more. There are things about myself I don't need to replicate.
Well, you do know that even when people have a child with their own eggs, like just natural conception, even the child doesn't look really completely like the parent. Often the child doesn't look that much like the parent because there's these mixtures of genes from the male also. And this mix-up of genes that occurs from what we call meiotic recombination means that maybe the child will look like you and maybe the child won't look like you. It's highly variable, really. But the most important issue, you mentioned epigenetics, and that means it doesn't always matter what your genes are. What matters is how they're expressed. And epigenetics is the science of how the genes are expressed. And actually, there is, just like there's fetal DNA in the maternal bloodstream when you're pregnant, there's maternal RNA in the fetus the same way. There's an exchange going on all the time. And maybe even more importantly than that is that personality, character, intelligence, emotional stability, and bonding is not in the DNA. It results from how you interact with the baby in the first 2 or 3 years of life. And so that's why we don't have any unhappy. Can you imagine that there are many parents unhappy with their children, perhaps because they don't understand child rearing science and issues, but those first 2 or 3 years of life are really crucial. And women that had to go through all this, and their husbands are so clearly devoted to that interaction with the baby in the first 3 years of life that it always turns out great. It's their baby. So I didn't know you were going to be open or frank about this. Most people want to keep this sort of thing secret. And the fact that you're opening up about it, which I didn't ask you to do, is going to be helpful for other women who've completely run out of eggs and in whom there's no other hope. And we just never had an unhappy case with these cases, and you are demonstrating that. So now tell me something about her, though. She's 6 years old now, is that right?
Yeah, she's 6. She is a force to be reckoned with. She is a creative. She's the type of child that will, ride her four-wheeler in a princess dress in the rain with cowboy boots, and like, she's just a mix of everything. She loves life. She loves to laugh. She loves animals. She's compassionate, but she's also really good at, better than I am at boundaries. Like, she'll say no, no, thank you. So she's really a terrific kid. Like I had mentioned before, I was a dancer, and she has an affinity for dancing. It's just really interesting to see. My donor, the woman that donated the egg, did not have any dance background. There was nothing dancey in her profile, but my daughter has this musicality and this dance ability, and it's interesting because I'm like, could that have come from, maybe she did absorb something. But yeah, she's a terrific kid. We are living on a farm. We have a lot of farm animals, and she loves taking care of them, and just yeah, she's just a really, I mean, everybody loves their child, I hope. So, and I love her to pieces. I did want to say, because you'd mentioned about, being open about the donor journey. I chose to be open about it because I wanted to give hope to women that were out there feeling like there was none. I was in a place in my life where I saw the potential for motherhood slipping away. And I think there's a stigma unnecessarily attached to the donor journey. And in not talking about it, I deny part of my daughter's existence, like how she came to be. And I think that's really, really important. There's no shame in it. I tell her she was wanted so badly that it took 3 people to make her. And she sort of, she's like, oh, okay. And I said, yeah, there's another lady that helped make you. And she's like, oh, all right, cool. Like, I've told her that right out of the gate. Because I think people might be worried, what will my daughter think? Will she think I'm not her mom? No, no, no. That's not the case at all. Other people choose to keep that information hidden in private, and that's a valid choice as well. Like, I think everybody should choose how they want to approach this. But for me, I think it's important just that other women know, like, hey, you can do it. I did it. I was successful. I love my child, like, to the moon and back, and I know that you will too.
So that's fantastic. Even though you were open from the very beginning, unlike the fear that many couples would have, there's been no stigma whatsoever. It's just natural. In your community, your neighbors, your friends, no one makes anything of it. Is that right?
So mostly. There you know what, people I could say, my dad used to have this saying, opinions are like, everybody has one and they all stink. So, I won't, so there are certainly people that might have thoughts and feelings about the choices that I made, but but to be honest, like, if somebody had a choice or a feeling about it, it doesn't really matter to me. That's their opinion, and they can hold on to that, and they can, feel that way, because you may come across people that have feelings about your choice to go with a donor egg. I had them before I knew what it was about. I was like, "Ooh, isn't that sort of like your husband had a child with another woman?" And that, like, I know there's a lot of thoughts and feelings about it, but once you experience it, it gives you perspective that is much different than when you're looking at it from the outside. So I have patience with people around me that don't understand it. I try to help them understand it by educating them. I try to be an advocate to other people that have had the same journey that I have. And if somebody has questions about it, I answer it honestly. And if they come back to me with anything other than, inquisitiveness or support, then I just don't discuss it with them again. And I let them have their feelings. That's all you
Well,
can really do.
well, this issue of adopted children looking for their genetic parents, that only happens, that only happens with children whose adoptive parents weren't adequately counseled. And they had a funny feeling, well, it isn't really our child, but we'll take good care of the child. And those feelings subconsciously are transmitted to the baby as the baby grows up, and the baby feels there's something different, uh, because the parents themselves don't tend to think, well, this, in many cases, not all cases of adoption, uh, it's not our child, but it's okay. I mean, we love him, but that comes across to the child in unspoken ways, and those are the kids that want to look for their genetic parents. But most adoptive kids, if their parents didn't have that feeling, if they just regarded the baby from day one as their baby, they know they're adopted, but they could care less. They have absolutely zero interest in finding the genetic or their genetic origin. Zero interest whatsoever. It's a non-event. Steve Jobs, who had a great family, refers to his parents, his genetic parents, as sperm and egg donors. He doesn't refer to them as his genetic parents. His parents are his adoptive parents. It's in his biography. And but you have an advantage, though, with donor eggs, in that you carry the baby, and there's just never a problem. It's the husband's sperm, but you carry the baby and you bond with it from day one, and there's just never a problem with donor eggs with feeling it's my baby. So you have an advantage with donor eggs as opposed to just adopting a baby.
Yeah, that is very true. Going through the experience of pregnancy, having, the baby grow with you and be a part of you. She was just always a part of me. I never thought any differently of it. And if she has questions, the way that I know that not all donor situations are the same. But for my circumstance, it was an anonymous donor. So I actually don't have any information about the individual. I don't even know her real name. So if my daughter has questions about the person, I can only share as much as I know. We do now have technological advances with like ancestry DNA and, different ways for you to find out more information about your genetic history. So if she wants to do that option, I will support her in it as well. And if she should ever find siblings, perhaps, half siblings, I'll support her in seeking them out, and I'll, be happy to help her in any way that I can, because her love or interest in another individual doesn't diminish anything that I have with her. It only expands. It means that there's another person out there, that could love my daughter, which to me is a win. So.
Well, you are really fantastic, Jennifer. Really appreciate your explaining all this. It's really fantastic. I will want to say one more thing, is that according to the law, it's very clear the intended parent is the parent. So there's never any legal question about who the parent is. And you don't need to go through an adoption agency. You don't need to go through a rigorous agency approach. It's your baby, and that's it. And the law recognizes that it's your baby, and the law could care less where the eggs came from. So it's great. You're just a fantastic human being, and I can understand how your daughter would be a fantastic human being. And it's really, really cool that she loves to dance and she's musical, just like you are, even though the donor had nothing like that in her pedigree. That's really, really cool. Everybody's going to be glad to hear that.